My name is Nishant Pandey. I am the CEO of the American India Foundation. Um, and on behalf of AIF, I welcome you all to this webinar on migration and humanitarian protection perspective from the grassroots. Um, I see that we now have more than 150 attendees, which is good. We have had um, we have had 430 registrations. So of course we are expecting more people to join. Um, but thank you so much for taking time out in these challenging and difficult times. And I hope that you're all staying safe and healthy. I will be moderating this session. So let me make some, logistical announcements. We are recording this webinar and we will be circulating a recorded version to all the people who have registered. We're also broadcasting it live on Facebook. But please note that participants' voice and video cannot be seen. So don't worry if you're sitting in your pajamas, you're not live on Facebook. Only the panelists' voice and video can be seen. Uh, we want to make it an engaging interactive session, and I encourage you to use the Q&A button at the bottom of your screen to post any questions. I would really like if you do not use the chat box. There is also a chat box right next to Q&A. Please do not use it for asking questions. Please use the Q&A button. We are having difficulty in getting one of our panelists from India to join the webinar. There is some technological problem and that's what caused a slight delay. But we thought we will start while we try to get him online. As you may know, AIF for the last 20 years has been working in India to improve the health, education, and livelihood outcomes for underprivileged communities across India. And we try to do it in a way that it strengthens the US-India relationship, especially on the people-to-people side and on the civil society to civil society side. And over the last 20 years, we have served more than 6 million um, people through our work. As part of our program portfolio, we have been working with migrant communities across India for the last 15 years through our learning and migration program. And we will, talk more about it. Given our very strong humanitarian mandate, and I want to share with you that AIF was actually born out of a humanitarian disaster back in 2001, 2002, when there was a big earthquake in Gujarat. So given our strong humanitarian mandate, we are providing immediate and urgent relief assistance to thousands of migrant families who are stuck in this current crisis. The second prong of our COVID response strategy is to support the medical community by providing life-saving equipments to COVID-19 centers and government-run hospitals, and by providing PPE kits to our frontline health workers. Uh, Thanks to your generous support and support from thousands of other supporters um, across the US and India, we are serving currently close to 80,000 people as part of our COVID response work across 12 states of India. It is in this context that we thought that let's organize a webinar to really understand what is going on in India. But just to kind of set the context before we get our panelists to weigh in, I want to show you a very common site in India. Let me try and share screen with you. Let's see how it's going to work. Okay, now this is a very common sight in small grocery stores across India, and you must be wondering what this has to do with the topic of the webinar. Well, my friends in the FMCG sector, FMCG is fast moving consumer goods, tell me that India is perhaps the first country where large global FMCG companies introduced the concept of selling soaps, shampoos, oil, tea, coffee, and many such items of daily consumption in small sachets. And this was primarily to cater to a very large market represented by some 500 million people who are engaged in what is called as informal economy or unorganized economy, and majority of them through daily waged work, who are not able to afford a full bottle of shampoo, but they are able to buy a sachet for 3 rupees, 4 rupees at the end of the day with their daily wage. Um, this is a very common sight, but we often do not notice it or do not link it necessarily with the challenge of migrant workers or with the scale of daily wage work or informal economy in India. For those of you who may not have traveled to India, I want to just give you a sneak peek, a small kind of visual on what a typical road in India looks like. And you will see how many people depend on simply the road in India to derive their livelihoods. So let me play this short video. This is a typical road in India. Just look at number of vendors, drivers, rickshawalas who are just who can't afford real estate in India and who simply derive their livelihoods from the road. Now, this population, this invisible population, again, we see them all the time, but this population is really, in reality, invisible. And it is this population, this invisible population, which has been the worst hit by the current COVID-19 pandemic and the resulting lockdown. It is when everyone else stayed back inside their homes to maintain social distancing, to comply with the lockdown, that suddenly this population, which had no homes to go to, and who were desperate to go back to their homes in villages and small towns, that population became visible. So you see these scenes, which I'm sure some of you may have seen on global print and electronic media. These scenes became very visible. These are migrant workers who are trying to get back home in absence of any public transport. Many of them had to walk for hundreds of kilometers. These are very common scenes. Um, and although they contribute significantly to nation building in India, probably
Yes.
for the first time, probably for the first time, uh, this challenge, this immense challenge that India has became visible, along with the desperation that drives these people to move to the cities in the first place, the desperation that makes them take the lowest paying jobs in India, and their lack of social security. Um, there are out of the 500 million odd people who are engaged in informal economy, about 140 million, according to 2011 census, are what are called as distressed seasonal migrants. And one of them is Fazil Bhai, who you see in this picture with his wife and his son. Fazil Bhai works in a sugarcane plantation, and he and his family of 7, including 3 children, had to walk for 40 kilometers on their way back home before the transportation organized by the district administration picked them up and brought them to their village in the district Dangs in Gujarat. Um, when he reached his home in the Dangs, he realized that he did not have the ration card, and many of these people actually do not have ration cards, and therefore he could not benefit from the public distribution system of the government. And uh, it is at that point that the AIF team provided them food and ration kits, which is what is supporting them. And now AIF is also helping Fazil Bhai and many others in his situation to get ration cards so that they can benefit from the government interventions. So that's the kind of picture, the scale, the complexity, the human tragedy that has unfolded in the last few weeks because of the lockdown in the country. But to understand this better and to understand what is really going on the ground, we have assembled experts from the ground, and let's hear it from them. Before I invite them, let me introduce. So we have Professor Pushpendra K Singh. He is the chairperson of the Center for Development Practice and Research, center of the Tata Institute of Social Sciences. He's a sociologist by training, and he has had a distinct career in diverse fields. He has worked with various academic institutions, international development NGOs, and grassroots organizations. We also have Dr. Swati Jha, who is the director of the Learning and Migration Program of AIF. She has nearly 2 decades of experience of working with marginalized communities across India. I'm also very happy to have Pratyush Das, who is a senior program manager with AIF's Digital Equalizer program. He has more than 20 years of humanitarian program management experience, including um, in leading response efforts in major disasters in India in the last 20 years. So, Professor Pushpendra, thank you so much for joining us. I'm really happy to see that you've managed to come in. I'm sorry that we had to start while we were waiting for you to join. But let me ask you my first question. You know, in India, the workforce is predominantly employed in the informal sector, and majority is constituted by migrant workers, as we said in the beginning. Give us a sense of how has COVID-19 impacted migrant workers. Are these images coming out of India representative of what's going on?
Okay. First of all, I should apologize for this delay because of the technical reasons. Okay, now coming to your question, we must realize that when we are talking about informal sector workers and migrant workers, so we are talking about a huge number. We are talking about 420 million workers who are employed in informal sector, which is more than the entire population of the USA. So we are talking about a large number of people. And you know, the size of the country of India is close to 1/3 of the USA, but the population of just these informal workers is much more than that. Now, who are these informal workers socially, in terms of social groups? This group is overrepresented by scheduled caste, the ex-untouchables, the tribals, scheduled tribes, and also minorities. And they are mostly employed in works which employ seasonal and circular migrants. Okay. Uh, then this group is also highly overrepresented by interstate migrants. That means people who have traveled long distances, who are unfamiliar in many cases, particularly when they are new, unfamiliar to those places. Even after staying there for a long time, generally they are not very familiar with the language. So they are generally disadvantaged people. And as my friend Professor Ravi Srivastav says, the work which these people do in informal sector, and particularly the migrants, you can call them difficult, dirty, and dangerous work. So those people who are involved in those kind of small, petty kind of, say, the occupations, they are also treated as second-rate citizens of the country. And these are the people who have also suffered discrimination, humiliation, also lack of work in their source places. So that means we are talking about very vulnerable population. And the number of this vulnerable population is huge. So when they come to urban areas, when they wherever they work, now generally in most of the cases, these people do not know who their principal employers are. They are very tenuous link with their employers. Now, in many cases, they only know their contractors. In some cases, they work with these petty producers, and these petty producers are just marginally better than the workers. So we are talking about this group which is informal. That means there is no formal contract. There sometimes their employers are unknown. They are at the mercy of the contractors, and sometimes their employers are so weak. So in these conditions, when epidemic like corona, when impacts them, so these people are completely vulnerable people, and they are defenseless, and they are not able to trace their employers. They are, and even if the government says that they should be paid their wages, but then in many cases, when the employers are very petty producers, they are not in a position to pay them. People are calling their contractors, they're calling their employers, but then the phone calls, there is nobody to receive their phone calls. So what is happening? Whatever the images which I saw, the last few ones, I would say these are the real images of the migrants and the workers, whether they are interstate migrants, whether they are intra-state migrants, but those who are coming to urban areas in search of work, the new ones who are standing at labor chalk, those who have links with their employers, who are working in informal sector, all these people are very vulnerable. And also remember the time. This was the time which is lean period for agriculture, because wheat harvesting had not started. So generally people migrate to, in those times, urban areas. Now, and this is also time when people had gone back just in the beginning of March to celebrate Holi with their family. That means these people had just come, might have borrowed money from in the village, uh, came with very small money to just survive for a few days, and then once they start getting their wages. Now, these are the people who are not in a position to send money to their family, but they do not have or have very little saving or little money to survive in urban areas. That's why we see so many people so desperate to go back. And many people, they started on foot. So many people died. The death, and then the deaths are always underreported. Many people died because they didn't get also the kind of the support, the medical support they required. So people died, but many deaths will not be ever recorded as deaths due to coronavirus. So the situation is really, really grim. This is what I would say.
Right, right. And Professor Pushpendra, the point that I was trying to convey in my introduction is that, this huge population of migrant workers is there in all cities, construction workers, factory workers, drivers, mates, street vendors, everywhere you see them. And that's the point of showing that video, which actually I personally shot a couple of years back. When I was visiting India. Uh, why is it that this population was invisible till now? And what do you think would be the impact of this? Uh, of course, the unfolding of the humanitarian crisis, but also the fact that probably for the first time it has become visible to both policymakers, but also to the society at large. Everyone is talking about migrant workers and their plight. Why do you think it was invisible so far, and what do you think would be some of the impact of what is going on?
These people have now come at the center stage only because of the optics and the kind of videos or the photographs which have come up, and particularly the number, sheer number, and because everybody is fearing everybody. So when you have so many people, poor people living in urban areas, so even the middle class inhabitants, everybody is, they fear these workers with whom who were employed in their houses as maid servants, or whose the labor work, the fruits of them they were enjoying. So now suddenly the numbers have become visible. But why they are visible? Because historically the development has been such that uh, in rural areas we have high landlessness. So the people are very poor. They are marginalized people in rural areas. Almost in the country, more than 40% population is landless. And they have been migrating historically to various places, right in the colonial period and even after colonial period. And there are people who have been displaced from their places because of development projects, sometimes because of also environmental factors. So
Right.
these are very weak people, to people who are marginalized. They
Right.
don't have voice. That's why it's easier to keep them invisible. And what has happened in the urban area, these people are seen as very important source, human resource, but at the same time, they are not paid well, and our policies have been very skewed in favor of creating a middle class. The middle class, which is very self-contained, which has become very insensitive. And we'll discuss this during this corona epidemic and the relief program which we are seeing, and the kind of say insensitivity which we find in the society, which is also in our policy.
Right.
So what
Right.
happens to these migrant workers? See, most of the units are registered under Shops and Establishment Acts, not under Factory Act. So the denial of their rights starts from there. And it's in full knowledge of everyone, the state, the employer, and the workers. But they don't have any other means, so they have to accept this fate. So
Right. Right.
they remain invisible in these
Thank
conditions.
Thank you, Professor. Swati, I want to come to you next. You are leading AIF's Learning and Migration Program, which works with hundreds of thousands of migrant families across India, right now, 7 states of India. What are the key insights from the field, and how is AIF and AIF's partners reaching out to address the sudden crisis that these migrant families are facing? Can you share your experience so far from the
Sure.
field?
Thank you, Nishant, and a lot of background setting that you gave, and Professor Pushpendra also highlighted that this was a season when people were coming back after celebrating Holi in search of work. If I look at my program areas, then there are certain parts where there was a lot of people employed, like sugar harvesting was going on. Sugar, they were employed in sugar mills, they were employed in transporting of all these things to sugar mills, and as a result of sudden lockdown, they had to leave everything. They couldn't collect their wages, and they've gone back. Many of them are definitely like they don't have ration cards, so they are suffering. Then loans that they had taken to travel for work, a lockdown meant that everybody had to return, and that too without any earnings. And these are the people who really need help. So during initial days of lockdown, civil societies, volunteers, and individuals came up with to provide relief till center and state governments stepped in. It took Delhi government some time to set up 113 shelters and food distribution centers. Mumbai similarly has 300 shelters now, but again it took them quite some time. In between, there are states like Chhattisgarh, uh, uh, which face the issue of migrants in transit, and they had to create some 319 such shelters for these in transit migrants. So this is one. Secondly, a lot of there was a disruption in supply chain in rural India's, and onus of responding to this challenge has fallen on panchayats. Panchayats have very limited resources, so they have to look for food. They are not able to purchase basic even gear and protective gear and equipment for Ashas and Anganwadi workers who are foot soldiers in building awareness and containment of COVID. Uh, this has also brought nutritional schemes and immunization to a halt, which is very critical for maternal health and child. And uh, from AIF's point of view, we took a very early lead in intercepting this issue and planned accordingly, connected with state governments, and also took feedback from field as to what the requirement is, and came up with various strategies at various point of time. It was just when the lockdown began, it was it was modified. So strategy as such is evolving And definitely, we are now looking into distribution, providing food relief, distribution of protective gears, and supporting health services on the ground. So these are some of the key, challenges that we are trying to meet along with our partners.
Thank you, Swati. One feedback that I'm getting in the chat box and also in the Q&A is that your voice is not very audible. So, in response to my next question, if you can speak, if you can come closer to the mic, that will be useful. Thank you for responding to my question, Swati. Pratyush, I want to come to you next as someone who has been actually uh, part of providing relief on the ground to many of these families that AIF has supported so far. What challenges did you face, and how are you navigating through these challenges? Of course, there's lockdown. People are supposed to stay inside their homes. So, how are you dealing with these challenges? And I know that you worked in other humanitarian disasters before. How do you find this particular crisis different from what you have seen before? If you can share your experience and insights, I think that will be very interesting.
Thanks, Nishant. Uh, Let me begin with our AIF's COVID strategy, which is compressed into this few words. It says, "Every day counts, save lives." This statement itself, it describes the seriousness of the prevailing situation and also the urgent need that we have to respond with immediate support. And this is what AIF has already undertaken, as was being mentioned by Swati and also reiterated by you. And while AIF continues with its relief response through implementation of various activities like prevention programs through the frontline leaders, to community support in terms of helping them with dry ration and some sort of relief, to even going to support medical equipments to the hospitals and medical facilities. Now, in all of these responses together, uh, we all know that there are several challenges, as everyone has been noticing and are being mentioned in the discussions. This is quite a normal in any kind of a humanitarian response, and especially in a pandemic of such magnitude, where all the systems and mechanisms are disrupted due to various factors, some of which we'll be going through. Now, as you said, yes, I did have the chance to work in a lot of disasters earlier, right from the Odisha super cyclone to drought in Rajasthan, Gujarat earthquake, working with Kargil war affected people, to tsunami affected places and Kashmir earthquake and so on. And now this COVID pandemic disaster response. Now, all of this too, if I categorize it into two different buckets, is altogether a different ballgame. While in the previous responses, we had systems functioning well, smoothly at the back end, especially the supply chain management systems, which was helping us to respond very efficiently. The COVID comes with its own set of challenges. To begin with, in our own context of what we have been doing so far, the first one that I would like to pick up is about ensuring the safety of our frontline workers. Now, even though AIF's mandate is to ensure the safety of its own team members and frontline workers, we have done a thorough orientation of all of them. But having done that doesn't, reduce all the risks of not getting them into situations where they might get contaminated. There are also other issues that we are dealing with. For example, flash mobs. In majority of our distributions, we have been noticing these reported cases of flash mobs where people all of a sudden gather across around you or your distributing teams to kind of quickly take in whatever is available. Now, these are situations where our teams are at risk, and it takes a lot more effort to kind of disperse them and again make a discipline and order to go ahead with the response. With the imposition of restrictions, as you said, there is a reduced rate of response, again because of social distancing norms that are in place, because of preventive isolation in some parts, and there are also ban on entry into some communities, which are posing as some of the challenges for our response teams to actually quickly respond to, which otherwise in other responses would have been a rapid response, so to say. Uh, in such circumstances, the AIF has been targeting mostly families where we have pregnant ladies, where we have lactating mothers, where we have women who are single bread earners for their families. And in addition to that, there is this whole group of migrant laborers in most of our communities, particularly those who have come in from UP, Bihar, Rajasthan, in the northern areas, and in southern areas, when I was speaking to some of my team members, there are also interstate and intrastate migrant laborers there. So there is, because of all of these issues, we are, even though we are trying hard to reach to the last of these beneficiaries, there is still a gap that has to be overcome. Now, the next point that I want to highlight is about reaching the most vulnerable. Now, our teams are dependent on collecting the list of such beneficiaries primarily on the basis of those team members who are present in the communities. That's the first level of collection of data or information about them. And the secondary source is basically the community leaders who are providing us with those lists. Now, as has been in the discussion, we know that because of lack of records, some of these migrant laborers are not on the records. So it's very hard to, at this point in time, to ensure that all of them are registered and are on our records, and whether we are reaching out to each and every one of them or not. So our dependency is again on some of this primary records. Next point that I would say is about the permissions from government. Fortunately, in Chennai, when we recently had distribution, the Madras High Court has given an order in favor of the civil society organizations for the workers to get a small letter as a permission and go out and be able to distribute. So those are enabling factors for us, whereas in the northern areas where we have been doing the response, we still haven't got the due permissions that are required to for the teams to be deployed more in more numbers. So we generally depend on the local sarpanch or the community leaders to grant us those permissions or accompany us in those distributions, and we go ahead and do those distributions accordingly. And lastly, of course, the priorities in terms of our activities vary from one context to another. So that again is a major challenge. And coming to the second part of how we have been able to navigate through this, yes, of course, we have done a lot of planning. The teams there have relied on their own experiences and their own information and intelligence. They have also been proactively ensuring that they take steps necessary to reduce as much as risks that they may come across in terms of social distancing, in terms of taking care of crowd management, in terms of having a proper distribution, but at the same time ensuring that they're able to reach out to those vulnerable people whom we have been kind of taking them into a beneficiary list.
Thank you.
Government has been a big support for us in terms of the community leaders who have been accompanying us in the distributions. And lastly, of course, the management support, wherein the response has been possible because of management's flexibility in terms of giving us some more added advantages in terms of permissions, giving us resources timely, and moving our supply chain to reach out to this vulnerable.
Thank you, Pratyush. I think this was very insightful in terms of how the distribution of assistance actually operates on the ground on a daily basis. Professor Pushpendra, I want to come back to you. No one knows how long this current crisis is going to last. And therefore, one kind of key question that all of us, I guess, face is that, you know, how does India as a country and as a society, how does it kind of sustain the response to the immediate needs of migrant workers through this lockdown? And what are the kind of more long-term key measures and policy changes that would be required to minimize the impact of such disasters in future on migrant workers?
Okay. Steve, first of all, I would say I'm not a medical expert, but so I would not go into that aspect. There are some questions regarding that. But what I would say that when the lockdown was decided, so migrants were, as you said initially, that these are invisible sections of our populations. So migrants were not in their mind, those who decided the lockdown. They should have given a few days of window for people to come back, particularly in those conditions when the infection load was very low. So now what has happened? You have huge population of migrants, both interstate as well as intra-state, and intra-state migrants are also huge, considering some large states where and where urbanization is low, there are only few urban centers. So people, large scale, they come to those places. So people are not able to go back. So sustaining the lockdown is really, really difficult if people, if there is no arrangement made for people to go back to their native places. So this is one challenge. It's a big challenge, and only government can actually face this challenge. And the second part is that as long as these people are there at destination in the conditions in which they live, so the fight against this infection is going to weaken, because the physical distancing is a luxury of middle class. Only we can afford that. These people who stay, say, in a 10 by 10 feet kind of say one room, 5, 7 people, 8 people, they hire in a small room. 100 to 200 people share just one toilet. So where is the question of social distancing or physical distancing? Where is the question of washing your hands with soap and water several times in a day? All these are just not applicable on this population. So sustaining lockdown humanly is going to be impossibility. And we have to think about how these people can be, and how quickly these people can be brought back, and how safely these people can be brought back. Now, the third point, which is important, I think, regarding this sustaining it, see, all the relief measures which have been announced by the government, and first I will talk about the central government, and then I will come to some state governments. So the relief measure of almost 1.76 lakh crore, which, because we are accustomed to this lakh figure. So now this figure is, if you decompose that, and then you will find that these are not for workers who are stranded at destination. All these measures are for people who are at their source, who are at their native places, where they have either land, where they have their bank accounts, or where they have their registrations done. So none of these schemes which have been announced, none of these are going to benefit people who are stranded in urban areas. Now, the third part of this, I will not go into all these details. For example, I will say, even the 1,000 rupees which have been announced by some state governments. In my state, Bihar, the government has said that those who are interstate migrants, they can register through an app with certain documentations, and they will get 1,000 rupees, provided they also have a bank account in the home state. Now, even if the government, say, transfers money, the government claims that they have transferred money to around 1.1 million people, and total 1.7 million people have registered as interstate migrants. Now, this money will go to the account which is at home, which is not at the destination. And what is happening in the banks, there's no social distancing. Thousands of people, or hundreds and thousands, are coming to banks to just inquire whether the money has come in their account or not. In the Jan Dhan account, the 500 rupees, in the accounts which are in the name of women, and or NREGA related money, or this 1,000 rupees money, people are coming there to just inquire. So these are not for the migrants. Even additional grain which have been announced under PDS, this will be at the place where they are registered and where their cards are. So still at the destination, these people have to purchase their grain and at the market rate. So none of these schemes are going to benefit them. Then the fourth part, that all these schemes which are for laborers, these are only three kinds of schemes which are not made for any present crisis. One is pension, which you get after you attain the age of 40, provided 60, provided you register before the age of 40. So even if you are you registered today and you are 40 years old, you will get it after 20 years. So you are not going to get anything today. Then the other is compensation in case of death or disability. So you don't want anybody to die. So unless people die, they are not going to get, the family members will not get any compensation, or unless you suffer some disability.
Right.
And the last one is medical insurance. So what I'm saying, unless, and they are also hospitalization is required. So there is no scheme to help people who are stranded in different places. And I'm giving you a figure of just one state. 1.7 million have already registered through their apps with the government of Bihar. So that kind of number we are talking about. So how we can sustain? First thing, still I'm saying that there are ways through policy measures where you have to universalize public distribution system. Whether you have ration card or no ration card, you have to provide grain, including pulses, also cooking oil, and gas connection or whatever to people. This has to be universalized. Second, the cash support has to be also universalized. Large scale cash support has to be given to people who are stranded. And so, and also the government has this nationwide infrastructure of midday meal program and this Anganwadis where cooked food is provided. They may not have, say, adequate means to distribute it. For example, they may not have utensils, adequate utensils, but the infrastructure in all towns, all small mohallas, all villages is there. So government has to actually activate this kind of system where you can provide food and avoid mass hunger or at least mass malnutrition. So that's how you can actually sustain this kind of lockdown, even if it's in partially, even in some areas, not in all areas, or only in contained areas, but to sustain people there. You have to do a lot, otherwise large number of people will die.
Thank you.
They will
Thank you, Professor Pushpendra. I'm just aware of time because I do want to take a few questions from the participants. So Swati, if you can be very brief, Professor mentioned midday meals, and you run a program that focuses on investing in the future of migrant communities by focusing on the education of children who belong to migrant communities. Can you share with us quickly, briefly, what has been the impact on the education of children in this whole crisis, with millions of people stranded, many thousands on the move, and many people who have come back to their home villages only to be quarantined? So throw us some light, but can you do it quickly?
Sure. So, Nishant, the loss of learning among these children due to closure of schools will have a ripple effect on their enrollment, especially for girls. And the situation has also highlighted the stark digital divide between rural and urban areas. Though many governments have issued directives regarding online education, but inadequate or non-availability of supportive digital infrastructure is a deterrent. Like the government of Chhattisgarh has launched a portal for online education just after the lockdown. But mobile penetration in the rural areas of the state is only 30%. So, they won't be able to benefit from this initiative. Secondly, what is happening with the, Childline 1098 revealed that the number of calls they are getting from children seeking protection from violence and abuse within the households has nearly doubled. And, isolation due to lockdown is intensifying a lot of mental health issues. Third is that the new academic session has started in April practically, but children in rural areas are without books, instructions, or guidance. And this might lead to increase in dropout rates, particularly that of adolescent girls who may have to face early and forced marriage. So programmatically, earlier LAMP focused on getting children to school, and now we were focusing on improving quality. But it looks like we might have to take a step back and focus on getting all these children back to school again. And here I would just like to thank a small group of women philanthropists from Boston Circle of Hope for supporting this intervention for 300 adolescent girls in migration affected region of Rajasthan to help them complete their school education.
So Swati, if if this is very useful, thank you, Swati. If resources were not a constraint for you, what do you think you and your team can do over the next 30 days, over the next 6 months, over the next 12 months, and over the, let's say, next 2 years? Give us a sense of what is possible despite all the challenges, all the constraints that we have talked about, if resources were not a constraint.
So, Nishant, in this context, this sense that we are getting from the ground is that economic stress on families due to outbreak can put children at a greater risk of exploitation. And at LAMP, we aim to break the cycle of child migration and labor and create positive life stories. Like I mentioned earlier, that nutritional schemes are non-functional, and so is immunization. And this will impact not only maternal health, but that of children too. So I would say that $5 support can, $5 can support nutritional needs of a child for 30 days. So if I look at short term, that is for 6 months, then children are, large number of children are falling behind in education. And in terms of their learning levels due to closure of schools, let's say a support of $50 can help child become school ready again in 6 months time. And medium term, we really need to support continuation of education of children, particularly girl child from migrant families, and retain them in schools. So if a $200 support, scholarship support for one girl can let her be in school for 12 months. This pandemic, like I said, has brought to fore the difference between digital infrastructure in rural and urban areas. So bridging a digital divide is an essential requirement today. And support of $2,500 can provide digital and online education for 100 children for 12 months. But to weave all this for a long-term possibility of making sustainable income generation and creating a rural-urban continuum, we need to focus on employability and entrepreneurship in these areas. And a $500,000 support can really help establish this program in one village for 12 months. So this is what, and last being disaster preparedness for villages. That's really important.
And Swati, I think you've already answered, and I've tried to incorporate many questions that we received on Facebook Live and on the Zoom call in my own questions. But I just want to focus a little bit more towards the end on the last piece you mentioned. I'm actually reading a question that we have received from one of the participants, Saurabh Avasthi. He says that given the significant impact this crisis has had on migrant workers, what steps should be taken by public-private partnerships such as AIF to help these workers not only weather the storm in the immediate term, but also provide opportunities to help them get their lives and livelihood back in the more kind of medium to long term? I guess his question is because many millions of migrant workers have actually gone back to their villages and small towns, and obviously by definition they have lost the jobs that they had in these centers. And so looking forward, what kind of models do you think can emerge in terms of providing livelihood options in those villages at the local level so that they are not forced to migrate to big cities?
So there are two parts to my response. First is that one of the most important activities that LAMP conducts is identification of migrant families in program areas, and with government we get that data, and it helps the government in estimating extent of outward migration, number of children that are going to be affected, and planning of their educational intervention accordingly. Now, this is an excellent opportunity to create a state-specific migration monitoring cells to track this migration. And in situations like this, facilitate interstate collaboration. And this will increase the visibility of migrants and ensure their overall well-being. I'll give an example that Maharashtra is creating a migrant workers dashboard registration where they are registering building and other construction workers to improve conditions of labor-intensive industries to provide social health, education, financial benefits, and under various schemes and programs. This is one. Second is that, and within AIF, we in fact, in February, we came up with an idea. This is like a combination of LAMP and Livelihoods program where Kamesh, Manish, and we came up with this iLeap, which is Integrated Learning, Employability, and Entrepreneurship Advancement Program. It leverages both LAMP and livelihood strengths and is a four-way approach, which starts with career guidance for school-going children, employability and entrepreneurship, financial literacy, and finance and technical resource center at the larger community. So here, what we have envisaged is using the existing learning resource centers that are run under LAMP in communities, where communities also participate, and facilitate all these components: education for children during a particular time with career guidance for them, then entrepreneurship and employability for youth and women. Then there's financial training for a community, and also community can use this as specific services as they. So I had mentioned earlier that it's a very cost-effective model that we have come up with, which will reach out to nearly 250 youth and women in a year.
Thank you, Swati. My last question to you, Professor Pushpendra. So Swati talked about some tangible project works that can be done at a local level with communities, with youth, with migrant workers who have come back to their villages to enhance their livelihoods in those villages so that they don't have to engage in distress migration in future. Can you share with us any kind of policy measures that you think the government, both the state governments and the central government should take to make sure that we are not going back to the same situation that we used to have before, and to ensure well-being and development of migrant communities in future, in the long run? Any kind of policy practice changes that are required? Professor Pushpendra, can you hear me?
Sorry. Can you just repeat the question? Sorry, I was typing.
No issues. Very quickly, we have only 1 minute left. I wanted you to kind of just mention any policy measures that the governments, both the state governments and the central government in India, should take to make sure that we do not go back to the earlier situation. Any measures that will ensure long-term well-being and development of communities that have been engaging in distress season migration in India.
I think the first and most important policy measure, long-term measure, is to correct all the structural norms. For example, improve the urban infrastructure for poor people, invest in community housing, invest in development of the areas where these people live, give them some decent kind of, say, housing, and all basic amenities which are required for healthy living. That's the most important thing. Universalize PDS, that make policies and programs which support workers now, implement some of the stringent labor laws which were meant to support the rights of the workers. And finally, I would also say is implement portability of rights of migrants from the source area to destination areas.
Thank you. Very clear, very concise, and very tangible. With that, we have come to the close. We have received a lot of questions. We have answered many of these questions. I see that there are still 11 questions which are open. What we will do is, along with the recorded version of this webinar, we will also circulate a list of questions with answers, the questions that we could not answer in the call. We will write answers to these questions and send it as a Word file or as a PDF file to all participants who have provided their email addresses. I want to thank all the panelists once again, especially Professor Pushpendra for taking time out to join us, sir. Thank you so much for all your inputs. Thank you so much, Swati and Pratyush. You are doing great job on the ground, helping families now and thinking about what can be done in the more medium to long term. And I want to thank all participants. We had a great participation, close to 200 people. Thank you so much for taking time out in this challenging and difficult time. And I wish you a very good health. Thank you so much, everyone.